Hey, welcome back to Sparking Innovation. This is a podcast from Provisio, the largest Salesforce implementation partner solely for human services. I'm Tom Moran, here to inspire nonprofits and government agencies to drive change in their communities by embracing change in their organizations. And at Provisio, we work with a lot of partners on our technology transformations. And one of them is Intellistack, which in June actually just changed its corporate name from Formstack, and moved its headquarters from Fishers, Indiana to Denver, Colorado. And so it's really great to have them on today during this exciting new chapter for the company. And if you work for a nonprofit or a government agency, particularly in the mental and behavioral health space, this partner spotlight episode, I think, is a really great way for you to learn how Salesforce consultants and technology partners work together to ensure that you have a really successful transformation yourself. And so Intellistack is a leading provider of data capture and process automation solutions that help organizations optimize the value of their data. And their core product, Formstack, which until very recently was the name of the company as well, provides no-code solutions that streamline online form building and document generation. And so when a nonprofit needs digital form solutions to improve data collection, Formstack is often what we use to handle that part of the implementation. But they also automate workflows. Intellistack's new product called Streamline unifies their key features to connect siloed systems so that users can design workflows that save time and energy and ultimately create better outcomes for clients and patients. And what's really great about this is that it even integrates with Salesforce to manage workflows involving those external sources that just don't have direct Salesforce access. And it's just one of the many products that are hitting the market this summer that are going to create major efficiencies for healthcare providers. We at Provisio have a whole suite of AI-powered products coming out soon that are going to be game changers for mission-driven organizations. You're going to have to wait for more on that in an upcoming episode, though, a little cliffhanger. So joining me now is Sarah Galyon, Senior Director of Healthcare Solutions at Intellistack. Sarah, thanks so much for joining the show. It's really exciting to get to dig into the benefits of Streamline during this really important time for the company.
Yeah, of course. Likewise, Tom. I'm excited to be here and talk about it.
Yeah. So, prior to joining Intellistack last year, I believe, right, you spent 17 years at the University of Tennessee Medical Center as a medical record tech, also cancer center coordinator and technical operations manager. So now that you're a leader at a tech company, I'm wondering, how did you go from healthcare to technology, and how does your healthcare experience sort of inspire your work at Intellistack?
So, interestingly enough, in kind of my very early 20s, when I first started at UT Medical Center, I really wasn't career-minded at all. I was just kind of, trying to break out on my own. And I took, a night shift job at medical records, and it was a means to an end, really. But ultimately, it turned into a very rewarding career, fortunately. I know everybody's heard how, healthcare professionals are chronically overworked, understaffed, and a significant root cause for the burnout in the industry is because of those reasons. I definitely felt that pressure when I was kind of in that environment, especially in the administrative side. So I'm not a clinician. I'm not a nurse, not a physician. I did the administrative work, the scheduling, like healthcare coordination, that kind of thing. And just from a place really of pure survival instinct, I started looking for ways to kind of streamline and improve my own personal workflows for my own sanity, really. And so I think the main turning point for me was when I was working in the Cancer Institute specifically. And one of my jobs was to keep track of the multidisciplinary treatment plans for breast cancer patients. And at the time, there wasn't an accessible place like in the EHR system where you could document that kind of stuff, especially if you're not a clinician. It just wasn't something that we were given access to. I mean, we could look, but we couldn't touch, kind of a thing. And so how are you supposed to keep track of your cancer patient's journey, really, when it's stuff that is a little more abstract and not, this is the medication I'm giving them, and et cetera, et cetera. It's a little more nuanced than that. So fortunately, I've always been very tech savvy. And I literally built myself an Access database back when Microsoft Access was a thing. And for the time, it was amazing, and it enabled me to be much more productive in that role. And then it caught the attention of our senior VP over the Cancer Institute, and she ended up asking me if I could expand it out so they could use it for all the cancer patients, not just breast cancer. So that's what I did, and that was kind of my first foray into what we now call digital transformation. This was back in I want to say 2010, 2011, somewhere in there. And the success of that simple enhancement, I think, led me to the role that I think was one of the most rewarding experiences in my career thus far. Getting to work with a person I consider my personal mentor. Her name's Dr. Julia Fansell. And she was kind of leading the charge for over a decade in clinical process design and spearheaded the Patient Care Pathways program at UT Medical Center. And I learned so much from working with her over the years and seeing how to appropriately use technology and digital tools to decompress healthcare work burdens. And that ultimately led me to procuring Formstack for the hospital, which is now Intellistack. But we used it for all these administrative workflows and processes that just kind of always get overlooked and nobody ever wants to think about because they're hidden in the shadows. But over the course of several years, I got to know the folks at Formstack really, really well. And they also became very familiar with my work. And ultimately, the CEO and the CTO approached me one day with this idea of bringing in a healthcare expert to help kind of guide the development of their new product, which is now Streamline, so that they could make sure that it was meeting the needs of the healthcare industry specifically. So, and now here I am. So that's kind of the Reader's Digest version of my journey.
Yeah, no, I think it's really interesting for you to have that real first person experience and direct experience, like having been in healthcare and now getting to use what you saw behind the scenes to help develop solutions to make it better for other people. And so I wonder if we could dig a little bit further into that when you were in healthcare, and you touched on this, but I'm wondering if you could give some more concrete examples as well of what were specific process inefficiencies that bogged you down and bogged your colleagues down, and how are you seeing tools like Salesforce and Formstack actually making that better?
Yeah, the big thing that personally I always found frustrating was how disconnected the clinical and the non-clinical workflows became, especially after we implemented EHR systems and got that into the mix. I'm not anti-EHR, but it did, for as many problems as it solved, it created just as many more. So, we're all on the same team. We're trying to serve the same patients. But I feel like the administrative staff often have very limited access to what they can do and honestly what they should be doing in the EHR system, right? And the administrative staff are the ones, and when I say administrative staff, I'm talking about your front desk personnel, the schedulers, your coders, your billers in the back office. I'm not talking about leadership. Sometimes people use those words interchangeably. So I want to clarify that I'm not talking about leadership. I'm talking about kind of the back office folks. But they focus on the patient experience, patient throughput, and just the overall patient journey. But at the time when I was in the hospital, nobody was addressing those needs. It's we have workflows too. And all the focus was being given to the folks at direct bedside care. And I completely understand how and why that would happen, of course, because they're front facing, they're with the patient directly. So of course, that is kind of a mission critical piece for success at the hospital or any healthcare organization. But fortunately, I feel like we now live in an age where that gap is being recognized. And if you really want to improve your patient throughput and your patient experience, you need to support the support staff who are keeping the engine running behind the scenes. So I feel like that's where Salesforce and Intellistack come into play specifically, because they are tools that support the needs or support the workflow needs that these folks have to do, but doesn't necessarily need to be done, nor should it be done oftentimes in an EHR system. I kind of feel like this is why 70% of healthcare organizations are still very much reliant on a fax machine, which is a piece of technology that kind of fell by the wayside for the rest of the world 20 years ago. But they still just use it and heavily rely on it every day. And I personally believe that's because
Yeah, that's
nobody's
amazing.
giving them an alternative. Yeah, so that's my drum to bang. I have a personal vendetta against the fax machine. I'm here to try to spread the message. There's a better way. We don't have to do it that way anymore.
Yeah. So let's talk about the release of Intellistack's Streamline. All right. So you were brought on to help develop this thing. So what is it, and what are the major outcomes that healthcare providers and health and human services organizations can look forward to?
Yeah, so Streamline's a no-code workflow orchestration platform. So the idea behind it is we have incorporated kind of those classic elements people are familiar with in Formstack, and then we powered it with a data fabric. And then we've also baked in very high standard security features that are required to remain compliant with data regulatory policies like HIPAA, GDPR, PCI, et cetera, like those kind of things. But the star of the show in this platform really is the data fabric. And this gives us the ability to incorporate and integrate literally any data source that you might have and pull that information into your workflow. So we'll make sure that we distinguish the difference between data fabric and data warehouse, because it's not the same. A data warehouse copies all your data into like a third-party database so that you can sync back and forth between the system. And then, sometimes you get this discrepancy on where the source of truth is. With Streamline, it's a zero copy platform so that it's not copying the data into our system. It leaves the data where it is, but it uses AI to read the metadata and the schema of that database, classify what type of data you have in that system, and give you like a full accounting of that information. So when you're pulling that in, it's not just a kind of a copy and sync back motion. It's as soon as you execute a workflow at that point, it will reach out and pull the data in. And you can edit it or do whatever you need to do with it, and then it'll write back immediately to the source of truth instead of storing it in our system. So we don't retain any of that data. And I think one of the biggest issues we often see in healthcare is not being able to access the information in their EHR systems. Those systems by design, unfortunately, are intended to be very siloed off. I've even sat behind folks watching them dual document in the same system. Like they had two different forms that were literally in the same system, but even those two forms wouldn't talk to each other. So they dual document. And it's just madness. So, we built a system that can integrate with your EHR systems. And I know a lot of healthcare people, when they hear that, they go, yeah, right, because they've heard that a million times and it's never true. But with our platform, we decided to partner with a company called Redox, and that's what they specialize in, is EHR integration. So when we onboard new customers that have EHRs, we put them in touch with our partners at Redox, and they get them all set up so it's ready to go, and you've got a nice bi-directional feed. So that's kind of the goal behind Streamline, to really give you the ability to create these customizable workflows in whatever you want to do and whatever you can imagine, really, and then power it with the data that you've already got.
And so for organizations that are already using Salesforce or considering using Salesforce, how does Streamline complement Salesforce, and how does it integrate with it?
Yeah, Salesforce was one of the first kind of native integrations that we worked on establishing with Streamline. It's such a widely used data repository that we knew it was going to be highly desirable. And so by integrating our Salesforce platform into Streamline, you're able to keep all your data, like I said, in Salesforce where it is. You don't have to migrate it out somewhere else. Streamline will just lay over the top of that, and you can create these workflows. So, and then you have the also added issue of, well, what if you're trying to get data from an outside source that doesn't have access to your Salesforce instance? How do you pull that data into the system without exposing things you shouldn't expose, or right now I think people default to kind of manual entry, right? This is where kind of the paper forms still kind of come into play, right? They'll have a customer fill out, a paper form, and then somebody will manually transcribe it. Whereas with Streamline, you lay that over the top and you can initiate workflows that you can intake data from external sources and then feed it into the system in a secure fashion without exposing your data erroneously to people that need access to it. So I think that's where the power in that lies. It works as a companion piece with Salesforce quite well.
Mhm. And what's been the reaction from Salesforce?
So far, we've had really positive feedback. We've got several customers that are working with us and with Salesforce to kind of set up some new workflows, not just in healthcare, but like in the education and the financial spaces as well. And that does seem to kind of be like what I just described, the main draw of now we can pull data in from outside in a secure fashion without having to come up with some crazy workarounds or, like I said, manual entry.
Sure. And so this obviously, all coincides with the company rebrand and, the name change. And so can you reflect on sort of like where Intellistack started as Formstack, of course, but like where, the company is going now and what does this all mean for Intellistack?
So, of course, I've only been with the company for about a year. So, my knowledge of kind of where it was is more from a customer's point of view, but it certainly kind of started as a digital forms company. And that was 15 years ago, which at the time, that was a need, that people had. Digital forms was kind of a more up and coming thing. And being able to collect and capture information in a way that you can actually do something with it was innovative. But the world has kind of progressed and moved on, and we felt that we also needed to kind of evolve the company mindset as well. Those products that we are very proud of still work and function and are very widely used for many of our customers. And so we wanted to retain that legacy as well and not just kind of get rid of it, but we also needed to step things up a bit. So that was kind of where Streamline came into play, was how can we, it's not an attempt to just keep digital forms relevant. It's an attempt to say, when you're working with digital data, you're not just capturing it for kicks and giggles, right? Somebody has to do something with that, right? There is workflow around every form, right? So being able to facilitate the flow of digital information in a platform, we felt was the next step. And so far it seems to be resonating quite well with our customers.
Yeah, that's really exciting. I mean, major transformation for you guys, and I love the new logo too. So,
Yes, me too.
I want to talk kind of big picture here too as well. We at Provisio are focused a lot on this concept of the digital front door right now, right? It's getting a lot of traction in the health and human services space. So, coming from the healthcare industry, I'm wondering if you could just explain not only like what the digital front door is, but how Streamline could be used to implement a front door solution.
Sure. Yeah. So the digital front door essentially is kind of like your organization's welcome mat. It's how patients and clients access services without even setting foot in the building, right? It's your patient intake, it's your appointment scheduling, documents, consents, signage, that kind of thing, which ideally would all be done online and can be done in a kind of a self-service way. There's a big push to really decompress the healthcare workflow burden. And one of the ways people are looking at doing that is how can we get the patient more involved in their care? Because that way we can automate a lot of the stuff that was very labor intensive in the past because it was so manual. But the patient knows who they are. They know their birthday. They know their address. They know this basic stuff, rather than having a human, transcribe all that information over and over again. How can we serve that information up to the patient and say, hey, we know you've been here before, right? And so that's kind of how we envision using Streamline for that. You can use it to automate that gateway for patients so they can submit their information from their phone. They can sign the consents, with their finger on their phone or, on a tablet if they have one. And then that will trigger a downstream workflow that hopefully eliminates the bottlenecks. So you don't have to, like I said, transcribe everything anymore. You can pull it in, say, okay, we got Sarah's information. She's updated her phone number, and it writes back to the system so that you don't have to wait for somebody to do it manually. So I think a lot of people assume that like their patient portal services are going to be able to facilitate this. And I agree it should be able to. But the reality of the situation, what I've experienced and what I've heard is those patient portals are just not great from a user experience. They're buggy. And you also are completely reliant on the fact that your patient has to take the time to actually sign up and create a patient portal. I think the last numbers that I looked at, there was the numbers are like somewhere around 40% of adoption rates for a patient portal. So that's pretty low. I mean, it's less than half. So what are you going to do for the other half of your patients, right, that aren't signed up for the patient portal? And I think this is more prevalent in like the acute care space, where if somebody walks into the ED and you want to facilitate kind of like a digital registration and check-in motion, but they're not going to take the time to sign up for a patient portal, right? So again, Streamline can give you that flexibility to where you can initiate that process without them having to create login credentials and that kind of thing. And then you keep things going and under a unified process.
Yeah, I mean, it doesn't just make things easier on your end if you're, working at the hospital or, at the Health and Human Services Department or whatever. It also creates a much, much better experience for clients and for patients. So really interesting to see all these things kind of come together and see more front door solutions coming out in the future, which we will have one at Provisio as well. Sarah, thank you so much for joining Sparking Innovation. Provisio is proud to work with you to transform human services organizations.
Yes, thanks, Tom. It's been great.
Yeah. And that's it for this Partner Spotlight featuring Intellistack. Again, we at Provisio have a lot of exciting AI-powered product announcements coming up this summer. They're going to be game changers for nonprofits and government agencies. Stay tuned for that. Thanks for listening to Sparking Innovation.